Srikanth, we can start the meeting.
Okay.
Or you wait for somebody, managers?
For a minute only, Dada, then we can start.
Yeah.
Okay, sure. So, Dr. Manika, you are there. If you...
Yes, sir, I'm there.
So we can start, right? Okay.
Yeah, please.
Okay, so that I can start. Okay. So good afternoon, doctors. I, Shrikant Dhanotia, on behalf of DIDAS, welcomes you.
Yes, sir.
Okay, good afternoon, doctor. Once again, I, Shrikant Dhanotia, on behalf of DIDAS, welcomes you for the Motility Matters webinar on Cinitapride, a safe prokinetic. It is our pleasure to have Dr. Monica Chinda as a speaker of today's Motility Matters webinar. Dr. Chinda is a medical advisor from DIDAS Life Sciences, Mumbai. We believe Motility Matters webinar will be useful in your day-to-day practice. After the sessions, you can have a round of discussion on the queries regarding prokinetics, especially for the Cinitapride. Now I request Dr. Monica to start the today's sessions. Over to you, Dr. Monica. You can start your session also and share this presentation also. Thank you.
Thank you, Mr. Shrikant. Hi and good evening to all the doctors. It's a great privilege to have everyone on our platform, and it gives me an immense pleasure that I have been giving this opportunity to talk about Cinitapride, which is one of the prokinetics and one of the very effective and safe prokinetic which has already been established. So I'll take this opportunity to share my screen. And without wasting much time, we'll quickly begin this session. I understand how important is the time of all practicing doctors, because you guys are very important for us. You guys are very important for the entire humanity. So my today's talk is regarding Cinitapride. Cinitapride, we say it's a safe prokinetic, and even the clinical literature states the same. The presentation of mine will just be of 15-20 minutes, in which I will cover that what is the epidemiology of GERD in our country and globally, what is the comorbidity and how is it related to GERD. We are also going to see a bit on the dosage, the mode of action and use in specific population of Cinitapride. Then I'll show you a few clinical trials which have been recent, so I thought of keeping them only in the slide deck. And then finally, we will see that as where can we position, where can we use this prokinetics. So in this fast-paced world of globalization, where everything in such a hurry, worry, and curry, it is responsible for a lot of multiple disorders, right? And amongst these multiple disorders, because of a busy lifestyle and the change in our food habits and everything, people generally end up having a lot of disorders, and one of those common disorders is your upper GI disorders, right? And they are there. I mean, it's like a tip of iceberg. The number of patients we see is just the tip of iceberg. Actually, below the iceberg, there's a huge, vast chunk which does not even come to the doctors, which sort it out on their own, right? And at times, this GERD is actually impacting the quality of life. It is actually impacting the patients to a lot of extent. So if I talk about GERD overall, this has been increasing since 90s. Overall, the global burden, I would say, is around 13%. And I think this is only the reported burden. We are not even sure of the number which is actually existing, right? So if I look at the Asian population specifically, it says around 12.92%. And to draw your attention to the Indian population, the prevalence in India ranges from around 5 to 28.5%, with a pooled prevalence of around 15.6%. The risk factors, I would say, are the age, the body mass index, the overweight individuals, the non-vegetarian food habits, the more intake of coffee or tea while you're in the office or while you're at workplace, having tobaccos, alcohol consumption, which is like very common and which is increasing, reportedly increasing. So overall, this shows that there is a trend of increasing patients who are suffering from GERD. So this GERD is not only in normal individuals, but GERD is also very, very prominent if I talk about comorbidities. Hypertension and diabetes are amongst the most prevalent comorbidities you see in Indian population. You must be coming across these patients who are suffering from either of the two or even both at the same time, right? And very young patients coming up with diabetes, very young patients coming up with hypertension. So I would like to draw your attention to a point that 40% of the diabetic patients have GERD. There's data which suggests that. And another data we were looking at was very astonishing, that 44% of the hypertensive patients have GERD. So overall, if you look at this chunk of population who already are having a comorbidity, and then GERD is like on the top of it, and GERD is already existing there, there's a unique relation, I would say. But to draw your attention to another point, we have established that GERD is very common in India. We have established now with this slide, I think I'm able to convey my point that it is very common in patients who are suffering from comorbidities. There is another factor which needs to be taken care while you are treating GERD. And the another factor I'm talking about is gastroparesis. So there is growing clinical evidence which shows that delayed gastric emptying may be associated with severe reflux, dyspepsia, or both. So gastroparesis, I was looking at one of the data and it suggested that this data was quite old, but it suggested at that time also gastroparesis is concomitant in 25% of the patients who are suffering from GERD. And I'm very sure if I look at the recent numbers, they'll be far, far more than what we are looking at. And gastroparesis being very common in your diabetic patients as diabetic gastroparesis, again indicates that, this factor has to be very much taken care of while you are treating your patient of GERD, right? Coming with with the advancing era, management has been getting updated from the time of 90s, and now we have come to 2022. There are various guidelines like the ACG guideline, the AGA guidelines, the expert reviews, even and Indian patients behave in a different manner. But these guidelines, at least the international ones, they set a path which we can follow. And then now the Indian guidelines also are highlighting the role of PPIs, prokinetics in the management of GERD, GERD with gastroparesis, GERD in patients with comorbidities. So to draw your attention to one of the recent guidelines, the ACG guidelines 2022, it recommends using a prokinetic along with the PPI in the case of gastroparesis. So if a patient has, gastroparesis and GERD, you can definitely use a prokinetic. You can give it along with PPI and the patient, will relieve from it. So now, the question arises which prokinetic to choose. And I would say Cinitapride is one of the best options as a safe prokinetic to use. Now, let us understand why Cinitapride is something which I am vouching for. So, when I say Cinitapride, the safe prokinetic, I'll just take you through the mode of action. We'll brush up on that a bit. So, Cinitapride has a role that it prevents the presynaptic uptake of serotonin. And because of this prevention of presynaptic uptake, your cholinergic transmission, acetylcholine, increases. And because of this increase in the acetylcholine, there is an enhanced response. And thus that leads to more contraction. And because that is leading to more contraction, there is an increased GI motility. So my one problem of decreased GI motility, I am sorting that out. The name prokinetic itself suggests something which is going to help in kinesis. So yes, by giving the Cinitapride, I'm actually increasing my acetylcholine and thus causing more contraction and increased GI motility. Right? Now, what are the advantages over other prokinetics? What is that which favors me to use Cinitapride over other prokinetics? So I'll highlight 3 points here. First of all, it is a 5-HT2 receptor antagonist. It is a 5-HT4 receptor agonist and a D2 receptor antagonist. But it has a very selective anti-dopaminergic profile. And because of this, the chances of less hyperprolactinemia or no or very less CNS side effect, which probably can be the case with other prokinetics. So this is one edge advantage which I say I have over the other prokinetics which are there. So I am not adding on to the patient's adverse effects. I'm not causing any side effect. I have no or very less CNS side effects, and there's a lesser chance of hyperprolactinemia. The dosage is 1 mg thrice daily. It is generally needs to be given before meals, like 15 minutes before meals. And when I say use in specific population, when you're choosing to give it in your pregnant women, you have to evaluate the benefit and the risk and avoid generally during the breastfeeding. Safety is not established in children, like all about the other prokinetics as well. So, why you have to evaluate the risk and benefit when it comes to specific population or special population. Now coming to the clinical trials, as I mentioned, I have summed up 3 trials which are very recent, which were published for Cinitapride. And one of those trials was this prospective cross-sectional multi-center phase 4 study. This was conducted from July 2009 to June 2010, and it comprised of 121 patients with functional dyspepsia. They were given Cinitapride 1 mg thrice daily for 15 minutes before the meals. And then these patients were followed up for 4 weeks. The basic intent was to evaluate the efficacy and safety of Cinitapride in treatment of functional dyspepsia. And they wanted to see how is this impacting the improvement of patients' quality of life. So the outcomes here were assessed by the global index score. The secondary outcome was seen by a percentage of change of total score, like the dyspepsia symptoms. And this was being done by using the 7-point Likert scale. So after 4 weeks, what they saw was, if you look here, the global index showed significantly reduction. I'll just use my pointer. Yeah, there was a significant reduction when compared to the baseline in your global index symptom score. So overall, the symptoms of dyspepsia were being reduced in patients who were being treated with Cinitapride. And a similar reduction in individual dyspepsia symptoms like early satiety, postprandial fullness, abdominal distension could be seen. And on the 7-point Likert scale, it shows a similar improvement in the subjective response. And the quality of life was also significantly improved at week 2 and week 4. So overall, this study did prove that Cinitapride is safe and efficacious when given in patients with functional dyspepsia. Another study was done in mild to moderate postprandial distress syndrome, predominantly of functional dyspepsia again, and it was compared to domperidone. So Cinitapride 1 mg was compared to domperidone 10 mg, given for 4 weeks in 383 patients, right? And what they wanted to see, basically, this was a non-inferiority trial. They wanted to confirm on the non-inferiority. Cinitapride did prove to be non-inferior, but had an upper edge when when we saw overall there was a reduction in the severity, a significant reduced overall severity of postprandial fullness, early satiety, bloating. So in terms of reducing this was far superior to domperidone. And between the groups, one could see that the symptomatic relief was better with Cinitapride as compared to domperidone. So overall, this phase 3 trial also confirmed the non-inferior efficacy of Cinitapride and an upper edge when coming to, relief of the symptoms like I just mentioned about postprandial fullness, early satiation, bloating. So that had an upper edge. Coming to one of the recent trials, which was published in 2022, and I would say in the 6th month, 2022. This was regarding prokinetic, and the best part was this was an Indian thing which was being done. The study was conducted over a period of 18 months from January 2020 to July 2021. They wanted to determine what is the efficacy of prokinetic in diabetic gastroparesis patients, right? We spoke about how predominant GERD is when it comes to diabetic patients, and how dominant gastroparesis is in terms of GERD patients, right? So this was done keeping that thing in mind, and this was a randomized open label trial conducted on 50 patients, and these were type 2 diabetic patients having diabetic gastroparesis. These patients were randomized to 4 different arms, and one of the arms was Cinitapride. 4 different prokinetics were chosen, and when they saw in all the 4 groups, there was a statistically significant improvement, right, in terms of your symptom relief, in terms of your ororectal transit time. So overall, this study showed that when you're looking at Indian patients who are suffering from diabetic gastroparesis, you can definitely use a prokinetic like Cinitapride in diabetic gastroparesis because it's a safe molecule, it's an effective molecule. So comes to my last part of the slide, my concluding remarks. GERD is a common problem worldwide, around 13%, and India ranges from 15.6%. I think that's just the tip of the iceberg. There's way beyond the scenario which we actually see. It's a common problem in patients with comorbidities like hypertension and GERD, which are very common comorbidities, specifically if I talk about Indian patients. So gastroparesis is another very common problem you see in 25% of your GERD patients. Your guidelines, your recent guidelines also suggest that prokinetics are recommended in GERD with gastroparesis. And Cinitapride is a safe and effective prokinetic to be used in patients with GERD, and the same has been supported by the clinical literature I showed you. So thank you for your patience. Thank you for your patient listening. And now I open the forum for everyone to, ask any queries if they have.
Ma'am, the queries are there in the chat box. You just
I'll do that.
So request to all the participating doctors, if anybody have any query, just put your query in the chat box. Over to you, ma'am.
Okay, so I can read the query. Just a second, I will access the chat box.
Or Srikant, you can read the query for Dr. Monica.
Yes, possible.
Yes, sir. I can read it now. Thank you.
Okay.
Yeah. So the query, I read it out for the audience as well. If it is diabetes and gastroparesis with dyspepsia, theoretically, actomide would be better based on the mechanism. Should we still consider Cinitapride? I agree to your point, doctor. But when it comes to diabetic gastroparesis, there is a recent trial which I just showed on, where prokinetics, where Cinitapride was being used, and this was done for Indian patients specifically. So according to that clinical literature, it showed beautiful results. So you can try it in your patients, and I'm sure the results would be satisfying enough. So yeah,
Thank you,
I hope
doctor.
I'm able to answer that query.
Yes.
Yes.
So I request to all the participating doctors, if anybody have any other queries regarding Cinitapride about the safety profile, you can unmute also and you can ask directly to Dr. Monica. That is also in here.
So one more point I'll just add on by the time when the doctors post the query, that Cinitapride's efficacy is not only due to the increase in the pressure of the inferior esophageal sphincter, but additionally you have a prokinetic effect. So it's like it's acting on the inferior esophageal sphincter also, it's giving a prokinetic effect also. So this is a molecule which is effective and safe, I would say, and it's been used since ages. So any further queries?
Okay. So ma'am, before we are going to closing the remarks, can you just summarize why it is Cinitapride, why it is better than the other prokinetics available in the market, and how long we can use, ma'am, for the GRD as well as for the gastroparesis indications? Yeah.
Right. So I'll just conclude by saying that Cinitapride, it is a safe and effective molecule, has been used since long, and there are trials which state that how safe and effective it is. Recently, we had an Indian trial also. So 1 mg can be given thrice daily in patients, and specifically because it's a prokinetic and it has actions where it prevents the presynaptic uptake of the serotonin, it increases the smooth muscle contraction, helps in your GI motility. So it'll be very beneficial when it comes to patients who are suffering from diabetic gastroparesis, or patients who are suffering from gastroparesis and GERD, or any patients who has comorbidity and develops GERD. In those cases, Cinitapride would be very effective and useful to be used as a molecule. And I would actually say that, I agree that there are other prokinetics available, but then because of the very selective dopaminergic profile, anti-dopaminergic profile, it causes lesser CNS side effects. And because of these lesser CNS or no CNS side effects, it has an upper edge, I would say, and lesser chance of hyperprolactinemia. Yes.
Yeah, thank you so much, ma'am. One more question is there in the chat box.
Yeah, there is another question. So, what are the major adverse effects with Cinitapride?
Yeah, right.
So, Dr. Monica, could you answer?
So, as per the prescribing information, if I have to mention, there is slight, some patients may notice a slight sedation, but not shown in with the recommended doses at least. On a rare occasion, you might see extrapyramidal effects like your spasm in the muscle and all. Otherwise, overall, it's a safe drug, and the CNS side effects are not there with Cinitapride. So this is what is according to the approved prescribing information, I would say. And even in the clinical trials, the very less number of patients, they at times developed the skin rash, but that was not the scenario, that was not a very common scenario.
Thank you, doctor, for asking the question, and thank you, Dr. Monica, for answering the question. Any further query, doctors? You can type or you can unmute also. It could be related to the Cinitapride, or it could be related dyspepsia or GRD. Anything further query do you have? Okay, I think so. We are not getting any.
One more question, Dada, is there? Is there
any?
any
I got a question.
Okay.
Is there any role? Is there any role in chronic constipation? Yeah, Dr. Monica, over to you.
So when it
Dr.
comes to
Gokul Khandelwal.
yeah, understood. So, so because the approved indication is not in chronic constipation, so I would not be the right person to comment about its role in chronic constipation. It is indicated in treatment of GERD and functional gastrointestinal motility disorders, where there is a slow gastric emptying. So, I think Cinitapride is. I'm not very sure whether we can place it in chronic constipation because the two approved indication is GERD and functional gastrointestinal motility disorders.
But Dr. Monica,
Yes.
as you say that it's a enterokinetic, I'm not saying that it could be used in the chronic constipation, but is there, because of this enterokinetic nature, the patient will be having a chronic constipation, it could be an additional advantage to the patient with laxative?
So in cases of chronic constipation, generally laxatives are best to be used. And at least, first determine the etiology of the chronic constipation would be a better scenario. And then if the etiology turns out to be one of the motility, the underlying etiology turns out to be gastric, then Cinitapride would play a role, sir.
Okay, right. Any other question, doctors? Thank you for your questions, doctor. Any other questions? So we can close the session.
Yeah.
So just to add, add to my previous point as well. Though the indication is not approved for chronic constipation, but I have read review articles and I've looked at few studies also, which have shown that, Cinitapride was better with as compared to metalloclopramide when given to patients, and there were improved defecation rates in chronic constipation patients. So yeah, the evidence is there.
Yeah. Correct. Actually, what happened, Dr. Monica, because a lot of doctors we have also discussed, they say that if the patient is having a long-term diabetes, it is not only the gastroparesis overall, that's a neurotransmission and overall the mortality, there could be the problem. So those diabetic gastroparesis patient having a problem of the, those diabetic patient having a diabetic gastroparesis problem, as well as the constipation they are reporting.
Yeah, right.
So, yeah, it is not a Cinitapride. You cannot say that it's an alternative to the laxative, but obviously with the laxative therapy, that could be an age because as a enterokinetic in nature.
Correct, sir, correct. Right, fine, sir.
Any other question, doctors? Any question, doctors? Okay. So, could we close the session?
Yes, please.
Yeah.
Shekhar is going to close the session, ma'am, I think. So yes, what do you, Shekhar?
Yeah, good evening, doctor.
Good
evening, doctors. On behalf of Zydus, I, Shekhar Viswas, would like to extend my thanks to all the delegates for your wonderful participation during this session. I would like to give
special... You are not audible properly.
We can hear you, Dada. We can hear him, Dada, properly. I think in your network issue.
Am I audible now?
Yeah. Now you are audible.
Okay. So, good evening, doctors. On behalf of Zydus, I, Shekhar Viswas, would like to extend my thanks to all the delegates for your wonderful participation during this session. I would like to give special thanks to Dr. Monica Chenda for her wonderful presentation. For any full text guidelines on GRD, please connect with Zydus local representative. We will continue to rely on your affection and support now and hereafter. Thank you. Have a great evening, sir. Thank you, sir.
Thank you so much.
Thank you so much.
Thank you so much.
Thank you so much taking out some time for this session. Thank you so much. We are grateful.
Thank you, sir. Thank you, ma'am.
Thank you,
Dr. Monica. Thank you so much, Dr. Monica.
Yeah. Thank you so much.
Thank you, Srikanth. Thank you, Shekhar, and all the guidance.
Participating.
Thank you.
All the participants. Thank you so much.
Thank you so much. Have a great evening ahead.
Thank you so much, ma'am. Yes.